And I want to circle back to something that Byron was talking about. We were all talking about it, which is that the payers are changing the game mid-game. You start somebody on something that's working, maybe they get a letter in the mail, everything changes. How do you start changing that? Can you change that? How do you enlist the payers to work with you as a combined team of stakeholders to get everybody better? I mean, can I say something maybe controversial? Does anybody go into the insurance business to hurt patients? No. They want to help people. Yeah. So they all, at least on the surface, seem to have the same drive. How do we get them?
Oh, but they're so removed from the patient that they think saving money is the primary thing to do to help patients. And that just doesn't compute for many things. So how do we work with this? I think that we really have to engage the patient community. Now, how many physicians are there and other healthcare professionals versus the 30 million people with COPD? If we can engage those 30 million or some group of them to help us, but we have to have a consistent message.
I'll tell you, they're going to come back and say, you've got 30 million people, I've got 270 million Americans, and they've only got this pot of money, so I've got everybody on my table, not just the COPD.
So I have, like the rest of us, have, you know, we're forced to have many conversations with the physicians. They're good people. They really are. Let me just say, they want to do the right thing by the patient. However, their world is that a contract has been reached between the insurer and pharma. Right. And some pharmas have really high prices and some have lower or discounted and what have you. So there's only limits to what the people, the PharmDs, for example, the MDs and the providers and the business people in the insurance industry can do given those contracts. And again, that takes place at another place. It's a business. You know, again, some of the heat has to be exerted on the companies.
I mean, I said before, wouldn't it be nice if everybody got together and some kumbaya together?
That's right, absolutely.
Yeah. What needs to be done to do that? It's really easy to sit here and yell at insurance companies and to go to an insurance company conference and yell at providers. Somebody's got to get them at
the experience of conditions like, for example, CF is as Barbara said, you have to get the patients involved.
That's right, and that's
have to get the
Byron's doing.
When you get the patients involved, you know, they can help to drive what is the need.
I know Byron's doing.
Initiatives like the COPD Foundation, you know, is a way. And multiple initiatives for other respiratory conditions and cardiovascular conditions. The patients have to be the one driving what are their needs, because the insurance companies, they have stakeholders that have to respond to. Right. So while you're spending 10, instead of spending 2 for the same therapeutic. And they don't see different devices, they see what is the implications after that.
Ultimately, the providers can only do so much. I mean, you know, people with this disease need to, and their caregivers, and I want to stress Barbara's point about that, need to stand up and they need to be heard. You know, it's not their fault. It's part of the problem with this disease from the beginning is there's this concept of blame, there's a stigma. Yeah. You know, that's ridiculous. You know, even those people who smoke, only a small fraction of people who smoke develop severe COPD. There's a combination of things. People need to stand up and say, we have the right to breathe. And that means having rehab, that means having medicines, having devices that I can use. But ultimately, it's the people and their caregivers that are going to have to raise their voices.